I'm Dr. Yelena Chorny. I'm Chief of Addiction and Trauma Services here at Homewood Health Center.
My name is Kerry Manthenga. I'm a clinical social worker by training, and I work as the Director of Clinical Operations and Programs for our inpatient addiction and trauma services here at Homewood Health Center.
My name is Hygge Schielke. I'm a psychologist and the Trauma Services Development Lead.
An experience or series of experiences that are so overwhelming that we just can't fully process them. And sometimes those experiences are so harmful to us that they actually break trust with the world around us or with other people or with ourselves. Trauma impacts people of all genders in quite similar ways, but one of the things that can happen uniquely for women is just how amplified the sense of shame can become. There are many messages we receive around us in life that already create a sense of shame for women who haven't experienced trauma. And so then experiencing trauma on top of those messages can really compound that experience of shame. Feeling worthy of care, feeling worthy of the time and attention that's required to take care of the trauma experience we're having is a barrier that women have to overcome to get here.
We also know that there are some women who choose not to come into treatment at all because of being in a mixed gender setting. That environment can actually be a barrier to some women. Some people really need a separation from their home life in order to be able to dive into the work that they need to do. So when people come here, they can exclusively focus on themselves, which most people aren't comfortable doing. It negatively impacts their relationships, their ability to work, perhaps how they're parenting their children, how they feel about themselves, of course, and their own safety. We know that the longer people go without getting the help that they need, the more pervasive these symptoms are.
The long-term impact can be to feel that you yourself are broken, no longer can be helped. Increasingly feel helpless and hopeless because you've tried lots of different things, but maybe not the things that are actually going to be helpful.
People's lives can really shrink. And so often by the time they've come to us, people have shrunk their lives, women have shrunk their lives in an effort to maintain a sense of control and safety.
For example, women who've been victims of human trafficking or exploitative sex work, victims of institutional sexual trauma, who have a really hard time being in an environment, particularly with men. We want a space for them to be able to feel safe so that they can actually dive in and do the difficult work that needs to be done and be able to make progress in their trauma treatment. Gender's non-binary, so we include in this, cisgender women, transgender women, non-binary people who are going to feel most safe in this particular environment.
We recognize the unique needs for a certain subset of women to have an environment where they're doing their trauma processing work that doesn't include men, that is more focused around people who've experienced gendered violence.
We start off with a period of providing foundations for the work. So trauma symptom management specific skills that not many programs actually focus on, but it allows them to have first starting off with a fair sense of themselves. So in the early stages, when someone's getting here, we're trying to really help them have a fair understanding of why they're going through what they're going through, how that's not unique to them, but it's their brain's way of trying to protect them from getting further harmed.
The unique balance of peer and professionals coming together to create an integrated healing experience. And I think one of the things that's particularly special about an inpatient treatment environment, and Homewood specifically, is that the relationships that happen between individuals who are here for treatment and the staff and their peers all create almost like a microcosm of life outside of here. The way that trauma impacts people out in the real world gets mirrored in how they engage those relationships or how they navigate problems and stressors here.
For some people, separating from their personal life and from their day-to-day life is really important and necessary for them in order to get benefit from treatment. They really get to focus all of their energy on their own healing and their own wellness, which for many people isn't something they've ever done.
We do know that this approach is of meaningful help to people who take the healthy risk of sticking with that sometimes very challenging, but also very meaningful and rewarding process.
I always want people to know that, things can get better. They leave here with skills and tools and a new perspective on their trauma. Again, the trauma's not gone, but they now have a different way of looking at it that helps them to move forward and live the life that they want to live.